Welcome everybody to our webinar today, Multidisciplinary Team Pilot Program Pre-Tender Information Session. My name is Jenny Pearson. I'm an Education Officer for the Primary Health Network. Before we go any further, I'd like to acknowledge the traditional custodians of the land that we're meeting on today and pay respect to elders past, present and emerging. I'm coming to you from Anawan land in the beautiful Northern Tablelands, where it's a balmy 7 degrees today in Armidale. We have two presenters for you today. We have Mitchell Coots, he's the Manager Primary Care Commissioning, and we also have Jackie Callagher, who is the Contract and Procurement Manager. Don't forget to type in any questions that you have in the question box, and we will endeavour to answer all of those today. This session will be recorded and there will be a copy in our education calendar within the next 48 hours. Hi, Amanda. Welcome to our webinar. I'm not sure if Amanda's talking today, but welcome. Thank you very much. I'll just turn my camera off now because you don't need to hear anything else from me, and hand over to Mitch.
Thanks, Jenny. Hi, everyone. Jenny, if you can just pop through the next slide for me, please. Thank you. So just a quick overview of today's session of the information we'll be providing. So about background to the MDT pilot program, MDT being multidisciplinary teams. The program aim as defined by the Commonwealth, I guess a definition of multidisciplinary team care, the pilot locations and health needs for these services that we'll be seeking to commission, eligible disciplines, some discussion or information about service models, and then just finalising up with some information about our tender process. Thanks, Jenny. So the Department of Health and Aged Care is leading initiatives that utilise the skills and scope of our diverse health workforce to deliver high quality continuity of care by supporting well-connected teams working together to address people's needs. One of these initiatives was announced by the federal government in the 23-24 budget under the Building a Stronger Medicare package for PHNs to commission locally designed multidisciplinary teams, MDTs, that support general practice and Aboriginal community controlled health services to improve the management of chronic conditions in the primary care setting. The MDT pilot initiative will run over 3 years to June 2027 to increase patient access to care in the community, improve the management of chronic conditions and reduce avoidable hospitalisations in underserved communities. The measure itself is designed to support small or solo practices that are too small to engage their own MDT workforce. Thank you, Jenny. Next slide. So these are the program aims of the MDT activity pilot program as defined by the Commonwealth. Aim 1 is to utilise the skills of MDT teams to improve patient outcomes, reduce complications and reduce avoidable chronic disease-related hospitalisations. And the second aim is to support GPs in the management of chronic conditions. Next slide. So MDT, what is that? What does it mean? We think it's a great, I guess, definition or information from New South Wales Health, which is what you can see on screen here. So an MDT is a multidisciplinary teams involving multiple health professionals from several different disciplines who care, collaborate and communicate together to provide comprehensive care for a patient or a client. And that's defined by New South Wales Health. Key elements of an effective MDT include harnessing the diverse expertise of health professionals from different disciplines, utilising their knowledge and skills, working together toward common goals for the patient, collaborating through effective communication, shared clinical review, problem solving and decision making, ensuring a client-centred approach by focusing on clients' needs, preferences and goals, and coordinating efforts to reduce fragmentation, avoid duplication and improving consumer or patient experience. Thank you, Jenny. So for our PHNs, here's some information about the pilot locations and I guess the health needs, a little bit of background. So through this pilot activity, MDT services are being sought in 2 locations in the Hunter New England PHN region to address 2 locally identified health needs. In terms of the priority locations, we identified these through a range of inputs, including looking at health condition and risk factor indicators, including chronic disease rates. We looked at barriers to accessing healthcare, social disadvantage, and underserviced populations in terms of the health workforce. The health needs that were in each location were identified using PHN needs assessment data and LUMOS data, which includes LHD data on hospitalisations and preventable hospitalisations, and general practice data on chronic disease activities. These identified health needs were confirmed and prioritised through consultations that the PHN undertook with local GPs in these two target locations, which has occurred over the last couple of months. Next slide, please. So the first location, oh sorry, Jenny's got to jump back one more. Thank you. So first pilot location is Moree, and the priority health need to be addressed through the MDT pilot is diabetes. In scope is type 1, type 2 diabetes and latent onset diabetes in adults. Pre-diabetes is not in scope for this pilot. We may review the scope based on demands, but at this stage, what you can see on screen is the different types of diabetes we'll be focusing on in the pilot initially. Next slide, please. The second pilot location is Muswellbrook, and the priority health need to be addressed is respiratory disease. Examples of respiratory conditions in scope include COPD, severe asthma, cystic fibrosis, pulmonary fibrosis, bronchiectasis, and pneumoconiosis. Out of scope is mild to moderate asthma, where the risk of hospitalisation is low, and an MDT approach would not typically be required. And again, we may review this scope based on demands. Thank you. Next slide. So eligible disciplines. So disciplines that can be commissioned to form part of the MDT include allied health professionals, nurses including diabetes educators, nurse practitioners, Aboriginal health workforce and Aboriginal health workers, I should say, and Aboriginal health practitioners, and assistant health workers such as, for example, allied health assistants. The services or the disciplines that cannot be commissioned as part of this MDT is GPs, general practitioners, dental health workers and administrative staff. Next slide, please. So for the composition of an MDT, would be in each location should include those that are key to addressing the identified health needs in line with evidence-based clinical interventions that aim to improve chronic disease management, reduce complications, and reduce avoidable chronic disease-related hospitalisation. It's anticipated that the MDT will be made up of a minimum of 2 different eligible health profession disciplines. Next slide, please. So for the MDT, for an MDT service model, it's anticipated that the initiative has not been designed as one team for a single general practice. It's expected that the MDTs will work across a number of practices in each of those locations. So we wouldn't expect the Muswellbrook team to work in Moree, but those two locations will be treated separately. MDT services should be available face-to-face from a physical base in each of the locations with digital enhancements. The MDT services should target vulnerable population groups and be provided at no out-of-pocket cost to the client. The MDT will have strong links to the referring general practices and Aboriginal community-controlled health organisations. MDT models include capacity for case conferencing or shared clinical review. It may include patient and a GP at that stage, but the key is that we're seeking communication between the clinical members of that MDT team. MDT services should complement, not duplicate other available services in the area, whether that be, for example, LHD services or other services that the PHN's commission, and the services should link to other PHN commission services where relevant or available. For example, any of the PHN mental health services that we commission. We wouldn't expect the MDT to do that as part of their model. We'd likely like them to refer to other PHN services or any other services that they're aware of in these areas. Thanks, Jenny. Next slide. So with MDT commissioning, single discipline organisations would be encouraged to seek partnerships so that there wouldn't be separate submissions. So we do encourage partnerships as part of the MDT pilot model. The MDT budget for each location will be available for assessment by prospective proponents once we issue our RFP, which you'll see some dates and we'll talk a little bit about on the next few slides. Where possible, we would look to support organisations that are already established and have an operational presence within the HNECC footprint. At this stage, we'll be looking at services commencing around February next year. So for this, we'll be talking a little bit about TenderLink in the next few slides, but we would ask that once you have confirmed your TenderLink registration, that you can confirm that registration with Emma Borringer at the PHN, who you may know and have been in contact with, and whose email details are contained on the final slide. And you can confirm that TenderLink registration, whether it's a TenderLink registration for a business or if individual TenderLink registrations in terms of a person. Next slide, please. So these are the indicative dates that we're working at the moment. So our request for proposal will be issued on Tuesday, the 13th of August. So this is done through our TenderLink platform, and will allow you to access the documents and look at information that you are then able to review and complete if you would like to make a submission to the MDT pilot program. They're open for approximately a month, so that request for proposal will be closing on 10 a.m. Wednesday, the 11th of September. The PHN and our evaluation panel will be looking at doing a tender evaluation around the 16th to 19th of September this year. We usually like to have interviews with organisations that are wanting to take part in the MDT pilot activities, and that's been slated from the week starting 30th of September. And we will be looking at executing contracts around 1st of December, and as mentioned, looking at services commencing about February 2025. So when the PHN issues those RFP documents, it contains all the information that you can review, including budget and the templates that we'd like you to provide the information on. Next slide, please. In terms of the mechanics of a tender and using the tender platform that the PHN utilises, I'll just briefly hand over to Jackie Kelleher, our Contracts and Procurement Manager. Thanks, Jackie.
Thanks, Mitch. Jenny, if you could just pop to the next slide, thank you. So just going to talk a little bit about the tendering platform that we use and the reasons, etc. So the PHN, I guess, under our funding deed, has an obligation to get the right services in the right place and for people and places in our region, So a key consideration for the PHN is obtaining value for money. And we often do this via competitive tender processes, as it assists us to evaluate and see what's out in the market and what's happening. And we are obligated, again, to produce or have evidence of value for money as we're contracting with Department of Health or Commonwealth money. So I acknowledge it might be a new approach for many of the healthcare providers, particularly in some of the regions across HNECC footprint. So recognising this, the PHN does have a series of webinars which explains the tendering process and can help you to prepare a competitive tender response. Those webinars are available through a link on the PHN website. It takes you to a YouTube channel. I think there's 8 videos which are excellent and can assist you to develop your tender response. So the PHN uses an electronic portal called TenderLink for all of our competitive processes. So this provides you with a copy of the package to download. We use that for, I guess, what we call a forum if you have questions and answers that you need about the tender package once it's released. We also use TenderLink as what we call, I guess, our evaluation portal. So we will build that RFP package into TenderLink, and you'll be able to submit your response electronically rather than completing 10 or 6 different attachments and uploading them. There will still be some probably attachments that we ask you to complete and upload, but the majority of the questions, it's an online form so that you can enter it directly into the system. So as Mitch stated, you must be registered with TenderLink before you can receive notifications. If you would like further information on that, so more information about registering for the TenderLink and how we tender for services is available under the PHN website if you go to navigate to commissioning and how do I tender. Jenny, next slide, please. So in terms of support with TenderLink, it's not a PHN hosted system, so you will need to follow the link to register. And you can do that via the link that's on this page here. But if you have technical questions around the usage of the actual TenderLink system, there is a phone number and an email address provided there. As Mitch stated, we do ask that you confirm that you have registered on TenderLink so that we know who it is that we're going to be talking to as we get closer to publish date. So again, as Mitch stated, if you are able to confirm your registration on TenderLink via Emma, that would be fabulous. Next slide. I think that's it for me. Jenny, if you want to move to the next slide. Yeah, questions.
No questions have come through the chat box. If anyone does have a question, because this isn't a huge audience, please feel free to turn your microphone on and ask a question or type it in to the question box.
Jenny, am I on microphone? Can they hear me?
Yeah.
Great. And just Jackie mentioned it before, but if there is a question that you realise you don't have it now, but you have it later, once the tender is issued, there is that online forum, so you can post questions on there. So this isn't the only opportunity you'll have to ask questions. You'll have another opportunity later if you don't have any questions right at this time. So thank you, Jen.
Oh, we do have one question that has come. Oh, no, they've just said no questions. Thanks, everybody. So I think you've covered the information so well. And as Mitch says, yes, you can reach out at any time. Emma's contact details are on the screen. Thank you, everybody, for attending. Don't forget to quickly fill in the evaluation at the end. It'll only take about a minute to do. Thanks, everyone.
Thank you.